Hello, audience, Dr. Townsend, and fellow classmates. My name is Nan Igarilin, and I am presenting to you my colorful rose bouquet as my whole project. Of course, I'm using the metaphor of this senior practicum project as the colorful rose bouquet because this project has taken a lot of time and effort to grow from a single piece of rose and to gather all the facts and informations and references as a whole. It has to be presentable, as beautiful they are, and it has to be informative as colorful they are. And it has to make sense, like it's sent for the place that I'm working currently right now, which is the home health. And this project should be also beneficial for our nursing career in addition to our patients and family members. Flower makes us happy, makes patients happy, uplifting, and worthy, and feel the quality of care. So I'm hoping to give the improved quality of care to our patients after I've done the binding all the informations, all the elements, all the roses together for this project. So one of the elements I have, there are so many elements, like I said. So one of the elements that I have is by starting out with the assessing by auditing our electronic nursing documentations. And after I have found out the common mistakes and major problems and issues in the nursing documentation electronically, and I also have another main elements that I have to train the nurses who I have to get information with the nurses and get the feedback and get information from the articles that I read. And I have to train those nurses. I have a teaching plan that I developed and make the training for those nurses and company happy about it. I'm happy about it. So let's get started. So first of all, I would like to introduce to you what is with the introductions, with the definitions. So what is nursing documentation? Why is it important for us for nursing? And what is the standard of documentation? What do you expect from us in the documentation? What the company expect from us? So what is nursing documentation? The definition, I got it from the Nursing Council of Hong Kong, 2010. Nursing documentation is any written or electronically generated information that describe the care or the service provided to a particular client or the group of clients or patients. Through documentation, nurses communicate to other healthcare professionals their observations, decisions, actions, outcomes of care. Documentation is an accurate account of what occurred and when it occurred. So why the documentation is important for us, for the nursing. Documentation plays a very important role in monitoring and maintaining the standard of care given to the patients. And also documentation acts like a strong evidence to the lawsuit in solving the case. If there are some compromising details related to the case, that the nurse has less chance of defending to the case. So documenting as detailed and as accurate as possible is the key to the success. And also documentation is the effective communicating tool among us, among healthcare professionals, doctors, nurses, providers. What is the standard of documentation? American Nurses Association 2010 summarized that nursing documentation should be clear, accurate, accessible documentation is the key to the safe, high quality care and evidence-based nursing practice. That being said, submitting the documentation on time is very crucial. In the home health, submitting the nursing documentation daily is the standard of documentation that the company expected for all of us, because documentation serves as a nursing colleague for us since we are doing one-to-one care. Okay, so this is what I mean by pieces of rose before becoming a beautiful bouquet, the whole complete finished project. We have the learning contract planned in previous other courses, and I have my learning contract planned approved on the December 10, 2021 by the ECPI University instructor. Then I do not waste any time and I discuss that discuss about that with my director of nursing, and she assigned me the mentor, assistant director of nursing. Her name is Jessica Edward, and my director of nursing name is Kim Deal. And they both are very supportive, and they both like my idea because it helps the company as well at the end. The idea and discussions, everything approved by Kim Deal, our director of nursing, 3 days after the approval. So it has already been approved like 2 months ago. So I have pre-planned it out everything, which is good, which helps me a lot in this term. And also, I would like to explain why I choose to do this project personally. Because in the home health, you see, home health really depends on the documentation, especially electronic documentation, help us to understand each other clearly, communication and communicating, and also it will serve the quality of care for the patients, family members, and the nurses and providers. So to support my idea of why I choose to do this senior Practicum project, and I have found this peer review article and most updated article written by Sheffy et al. 2022. This article is the title with the development and the evaluations of an electronic nursing documentation system, which that article confirms that electronic nursing documentation system helps to reduce the nursing documentation burden and improve the communicating by the type documentation rather than the illegibility of manual documentation, which can be interpreted wrongly. And because using the software, and the software help us to understand the trend of the vital signs and the patient's clinical conditions and such. So it is very useful. And also in this study, they have surveyed 150 registered nurses identifying the positive and negative impact of the system. And after the survey, they found out, the system has found out that the system has actually prevent 65% of the legal issue and reduce 95% of the documentation errors and reduce the hassle of the paper documentation process, because I have been through those paper documentation process before, and it is painful process though. 82% of the nurses state that their time was saved utilizing the electronic documentation system. So I would like to thanks to the system of our ECPI University, because the journaling daily really works. It's really like, it helps me with gathering the information. It's like I said, this project has so much information. So when I have the journal in one place, and it already gather all the information when I need it, it's easy to keep track with. There are a lot of steps involved to finish this project. There are main steps, steps. So I would like to kind of summarize what are the main steps that I have done. First, I audit with the company's given guided audit sheet by my assistant director of nursing, Jessica. And also I collected the common mistakes and findings from the 10 audits, different cases and different nurses. And I contacted my mentor and gathered all the information to set up the training after I had found out what are the common mistakes. And I have contacted the nurses who got audited, who got their documentation needed improved for the training. And I prepared the teaching plan, which I have done past terms before. Teaching plans really helps me kind of organize what I need to teach and how am I gonna be successful with that teaching and training. So with the teaching plan, and I made the video presentation for the training to train those nurses, and I sent out those video presentation evaluation forms, which are the quizzes. I sent them out to the mentor and participant nurses. And I audit their recent documentation after I have trained them, and they are all passed. So I'm happy about that. This presentation has framed me for only 10 minutes, so I will not play this whole teaching presentation because it has 11 minutes of that. And but I am going to show you how it's kind of looks like. I'm going to skip through to perform this audit together with our assistant director of nursing, Jessica Edwards, not forgetting the participant nurses who I get to know and learn so much from their documentation. My overall goal of having this teaching presentation is to educate the field nurses on findings of the audits in their recent nursing documentation and things to improve on the findings. After this short presentation, you will be able to recognize the area to cover in nursing documentation using the audit sheet as a standardized checklist, and you will be able to write the nursing documentation, nursing narrative as clear and detailed as possible with the unusual events on the shift, and will get the patient, if capable of, or family member's signature when the nurse is signed out. Basically, this is the summary of what you will be documenting. Daily basics in your shift. We will need the minimum of 2 patients identifier. Any incidents happen on the shift. Really hoping that you like this and you feel this is beneficial for you.